To mental health. Illinois is one of 10 new states chosen to participate in the federally funded Certified Community Behavioral Health Clinic Demonstration Program. That's a whole lot of words, but the bottom line of this is the program expands and improves access to mental health care and substance use services. How? Well, right now, if someone needs treatment but can't pay, these certified centers can get reimbursed. But this new program provides higher rates of reimbursement through Medicaid. So it's estimated this program will bring an additional $150 million into Illinois' behavioral health system. And locally, 3 clinics were chosen to take part. Here to talk about all of this is Illinois State Senator Mike Halpin. Thank you so much for being here with us.
I'm happy to be here.
Yeah, beating the storm. We'll try to get you out of here before it starts.
I'm looking forward to that. Get at it.
Well, why don't we start with what are the 3 clinics that were chosen in our area?
So there's a couple of Robert Young Center here in the Quad Cities, as well as Bridgeway out of Galesburg. And I'm excited to have that opportunity to really show what our mental health providers and mental health professionals can do in this area if they have the resources.
Yeah, let's talk about that. Why these clinics? What was the need that was being seen?
Well, the need is across the state and across the country. There's no aspect of our lives and our society that isn't impacted by mental health challenges, whether it's K through 12 education, higher education, and the mental health of college students, our police response to individuals with mental health challenges, really, and the labor force as well, and problems at work. We have too few providers and too much need, and so this is a way to see if we can get better results by investing and really injecting more money and resources into the problems that we're facing.
I mean, it seems like it might be an obvious answer, but how does this help? How does this help both the centers and the clients they treat?
Well, it allows our providers to make sure that they can afford and recruit the best best professionals, their therapists, to make sure that they can provide the best services. Right now, the problem that we see locally and across the state is we don't have enough professionals. We're not graduating enough, we're not being able to hire enough. And so what this money can do is really incentivize people to work at these centers, and then in turn we do data collection. We try to make sure that we can find out what services they're providing and follow the outcomes. And I think what we're going to see is when we do have more resources in the area, we get better outcomes. And the idea is that then this turns not just from a demonstration, but into a full-fledged investment in mental health resources.
I'm thinking too about, the long wait lists at even the centers that you just mentioned, and how if you have more providers there, it could help out so much. But I wanted to ask you, across the whole state, 19 centers were chosen. To have 3 of them, which is like 16%, be in our area, what does that tell you about the needs here?
It tells me that the needs are strong here, but I also think that we have existing providers that do a very good job with the limited resources that we've currently been providing. And so I think the governor and the federal government have seen the work that we can do and are anxious to see what we can do when we even have more resources to do that. I think it speaks well for what we do in addressing mental health challenges here in the area. And I'm hoping to see those wait lists get shorter as we go through with this program.
Well, what else are you hoping to see? Before I let you go, what else would you like to see done to help mental health in Illinois?
Well, one thing we did was we put extra money into the mental health on campus for higher education. I'm chair of the Senate Higher Education Committee, and that is a very vulnerable population as people are going to school or back to school mid-career, facing transportation issues, childcare issues. A lot of that stress and pressure as you're also trying to get a degree can really get to you, and we need to make sure our campuses are supporting those folks. So what I would love to see is increased investment on the college side to make sure that people aren't falling through the cracks.
Yeah, important topic.
Absolutely,
sure.
Yeah.
Senator, thank you so much for your time today. I really appreciate this.
I'm happy to be here. Thanks so much.
And for you guys at home, Illinois, once again, is one of 10 new states chosen for a federally funded program giving more money to mental health centers. Iowa was also chosen for this. You can read more about all of this on our website.